All right, guys, live action, live action. I see some of you guys around here already. Yes, I love it. Dr. Pinesett here, the Premed Productivity Expert, and today we're talking about clinical experience. Oh, the heart of every future doctor, that clinical experience. It's essential to get into medical school. It's essential even when you're in medical school to get the right clinical experience to shape your career. And so today we're going to talk about how to maximize your clinical experience, how to maximize your shadowing. That way you can learn what you need to learn. You can get yourself into medical school and you can advance to become this amazing clinician you want to be. And this all comes from an encounter I just had with the medical students. I want to share it with you guys. You can learn from their mistakes, not make those mistakes, and be successful in clinical experience. We're going to hit the intro and we're going to get right into it, guys. Let's go.
But stop making excuses. Stop whining. Stop, right? Get at it. No excuses. Just dominate.
All right, guys. Thank you so much for joining me. Like I said, I'm Dr. Pinesett. I'm the Premed Productivity Expert, and I'm here live action every Monday, every Wednesday, 4:30 Pacific time to help you get better, to help you be more productive, and to help you be happier, more positive in your pre-med journey. Now, today we're talking clinical experience, and this is fresh on my mind because I had a medical student rotate with me recently, and as they rotated through, you guys know I'm an anesthesiologist, they rotated through with me. They made some cardinal mistakes that lead to a negative experience, not only for the student, but also for all those people around them and for the clinical providers and for the patients and so forth. And so I want to share with you guys what happened. And so the student came and they made one of the biggest blunders you can make as a future doctor, as whether it's a pre-med, a medical student, or even as a resident. It's one of the hugest mistakes you can make. And so let's start there. And that is attempting to be a know-it-all when instead you should be focused on being a learn-it-all. Hear what I say here. This is literally, if you get nothing else from this video, listen to this and learn this, and you'll go far. In medical training, they stress with you. It's about lifelong learning. And when they say that, sometimes we don't quite understand what they mean. Oh, lifelong learning, like, okay, I'll be learning for forever. And we just hear it and we don't really internalize it and really take time to understand what that means. What it means is that for you guys, at every single step of your medical journey, there is constantly opportunities to learn more. You will never be done learning. You will never be able to learn everything and know everything. And so you must be in learner mode and student mode at all times to flourish, to thrive at all levels. Personally, guys, one of the hardest things in transitioning to medical school is that for so many of you guys as pre-meds, you've been the A student. You've been able to learn everything for your exams. Then you transition to medical school and you recognize, man, medicine is deep. There's a lot of stuff here. I can't possibly learn everything by test date. And so it gets very frustrating for students. They feel very frustrated. Oh my gosh, I'm not getting my, and then they transition to clinics. Oh my gosh, I'm not doing my clinics right. Like we have these early patient experiences, but I don't know what I'm doing. I'm floundering. And they set these bar crazy high for themselves. And instead, what I want you guys to do is recognize that's what it's all about. It's there. You're there literally to learn constantly. They put you in these awkward predicaments so that way you can feel awkward, recognize this is rock bottom. It only gets better from here, and you can learn and you can grow. But if we have this unrealistic expectation for ourselves, if we have this whole thing like, oh, I should know everything, know it all, it leads you to like feel angry, to feel upset, to feel disheartened, to feel less than. And that's what happened with this student was. This student was trying to act like a know-it-all with me. And I'm like, you can't know everything I know because I'm a seasoned anesthesiologist. You're here on rotation trying to learn about anesthesia. So what good does it help you to try to seem like a know-it-all when I can see right through you? You can't be the expert I am. You're here to learn from me. So they were literally, they would ask me something or something would happen. I'm like, hey, listen, this is a good point. And I would try to teach them. And while I'm speaking, they start speaking. I'm like, you know what? In airway management, it's really important. Oh yeah, because we gotta keep the airway open. I'm like, sure, I like the excitement, but can I finish my point? Like, yes, we have to keep the airway open. That's step one, but how do we do that? And so for you guys, that's what we want to avoid. It's not about showing how smart you are. As someone who went through the whole ranks, everyone always was impressed with me on medical rotations. When I shadowed people, even before that, long before, even as a high school student, when I shadowed, they were impressed with me. And it had nothing to do with everything I knew. It had everything to do with my eagerness, my willingness to learn and soak up all the good information to make them feel like know-it-alls and make me feel like a learn-it-all. And they say they've done studies on this. Some of the best, they say, conversationalists. It has nothing to do with what they say. It has everything to do with how they listen. because we as people like to feel listened to. And as an educator, as a senior anesthesiologist, if I have a medical student rotating with me, if I have a pre-med shadowing me, I want them to recognize they don't know more than me. I want them to show the deference to be like, Dr. Pinesett, teach me all the good stuff. I want to learn all this. This is amazing. I'm so excited. Teach me it all. I don't want them to try to show me what they know. And it's important, guys. So again, at a psychological level, to make it a much more enjoyable experience. Then you recognize, like, hey, I can't look dumb enough. I'm here to learn. Let's go. Let's look dumb and let's do things. Let's challenge ourselves. Let's try an IV. Let's try an airway. Even if it goes terribly, I'm here to learn. I don't put that pressure on myself. Professionally, you'll do better because you will step out. And so this medical student, for example, I mentioned how they were already trying to interrupt me and seem like a know-it-all. But they also, every time I say, hey, listen, you want to try this procedure? Like, hey, blah, blah, I'm trying to teach them something. They kept shying away. Oh, no, I don't want to do that. I don't want to do that. And they were doing it because they didn't know how to do it and they didn't want to look dumb. And what they, again, failed to recognize is, I know you don't know how to do this. I know you've never done an airway. I know you've never done an IV. You're here to learn these experiences. Otherwise, why come? Why have a clinical rotation if you are perfect and you know the procedures already? And so instead, right, the juxtaposition of that is I've had pre-med students come and I've shown them how to do techniques and they're like, oh, wow, blah, blah. And they've picked up things because they were open to it. Same thing with other medical students. That's what it's about, guys. You can learn a ton, but you can't learn anything if your mouth is moving. You can't learn anything if you close your eyes and run away from everything because you're too scared to mess it up. You're there under my supervision to learn, to mess up, to make mistakes. So I can tell you, ooh, don't do that. They'll bleed out. You're going to bleed out the patient so you can make the adjustment and be more successful. Does that make sense to everybody what I'm saying right now? It's crazy. Like, oh, I don't want to do an IV. I'm scared. Don't be scared. Take that fear out your heart, that need to get it right, and just say, you know what? I'm going to stick this needle in there, and I may or may not get blood. I may or may not strike oil, but either way, this is one more miss that gets me closer to getting the IV correct. And as someone who's done literally, I can't even count, guys, but I've done so many IVs. It's like second nature for me to throw IVs. Now when I train medical students or residents, I look back and I'm like, watch them struggle, and I just laugh inside because I'm like, I can remember when I was there, but now I can't miss, baby. I'm on it, and it's all through all those reps. It took all the misses, all the frustrations, all the mishaps for me to now be like this amazing anesthesiologist who gets the job done with my procedures. Does everybody understand? So if you want to be a great clinician, you're trying to step up to that. So we can't be the know-it-all. We have to be the learn-it-all. And that's the approach, that's the philosophy we want to have going into clinical experiences because it makes it amazing for everyone. That's literally the only criteria I have for my evaluations. When I'm evaluating pre-meds, because they're going to ask me for a letter of recommendation, or I'm evaluating medical students because they're going to want a letter of recommendation for their residency, or I'm evaluating residents to see if they promote. I'm always just looking for someone who recognizes and understands that they don't know everything. They know the limits of their knowledge. They're willing to accept the challenge and try things, and they're willing to say, hey, I don't know this, help me more, and ask for assistance when they need it. And if you can do that, and you got a good attitude about that whole spectrum of learning, you're gonna get an A recommendation from me. But if you've got a funky attitude, every time I give you some feedback or some instruction, that's gonna be a problem. Do we all understand? If you like this right now, like this video, let me know. You're here with me, Dr. Pinesett, the Premed Productivity Expert. I'm so excited to talk about this topic. I love clinical stuff. I love teaching in the clinical environment because you see people, right, as pre-meds, a lot of times you could be in the classroom and you're like, oh, this is cool, this biochemistry, okay, cool. And it doesn't really translate for you. But then when you get into clinical environments, you get to see the diseases that you kind of learn about. You get to see the biological process. So a lot of times I like to take like the clinical condition. I'll say, listen, they've got this patient who's got this asthma. Okay, with this asthma, what's happening? Okay, let's take it back to your physics class and let's talk about how the diameter of a circle and surface tension, how that works in the alveoli, the lungs. And so I try to bring in those basic science concepts. So we love to teach, we love to educate. And so I get excited in these clinical experience opportunities because it's an opportunity to see your guys' eyes just go, oh, this is what I've been working so hard for. It's for this. This is why we took physics. This is why we took chemistry, because all this stuff comes into play to keep patients alive in a practical way. Now, we've talked about this lifelong learning, getting over the fear of not knowing everything. So let's talk about some key strategies to not be that mistake-prone medical student that I just had and to be better. The very first thing, guys, is when you guys go for clinical experiences, whether it's shadowing or your actual clinical rotations, is it's not okay. Again, you don't have to know it all, but it's not okay to become unprepared for your level of training. Did everybody hear what I just said? It's not okay to come and show up in a clinical environment not prepared at your clinical level. So if you are a pre-med and you're going into a clinical environment, nothing is really expected of you from a clinical knowledge standpoint. However, you should have a basic understanding of the specialty you're going to shadow. So if someone comes to shadow me as a pre-med and I'm an anesthesiologist and I say, hey, you're shadowing me as an anesthesiologist, what do you think is cool about anesthesia? Or what do you know about anesthesia? And they're like, anesthesia, isn't that with a foot doctor? And you have no idea what anesthesia is? It tells me that you're just hunting around for shadowing opportunities and you don't give a crap about what I'm doing. You don't value my time, my day, something I spent my life cultivating as a great anesthesiologist. You don't value it. And as a result, I see you, you're not prepared for this moment, so I'm not going to teach you. And I'm not going to write you a letter of recommendation because you're not thrilled to be here. You're wasting my gosh darn time. My gosh darn breaths are wasted on you. Do you guys understand what I'm saying? That's what you guys have to understand. So come prepared to your clinical level. Understand what the specialty is. Understand what that is. At a pre-med level, you shouldn't know the clinical stuff, but if I take a clinical situation, excuse me, and I make it basic science for you, so if I start talking about delta P, if I say, hey, listen, a lot of physiology is based on physics. That's why they start with that same phys. And within the physiology, a lot of times, right, we're talking about flow, whether it's flow of air, whether it's flow of blood in terms of blood pressure, right? So that delta P, that gradient is very important. Does that make sense? And I'll talk about systolic blood pressure, diastolics, and I'll talk about airflow to the lungs and how to increase oxygenation with PEEP and so forth. And we'll have this discussion and I'll bring it all back to delta P, a basic physics concept. P1, P2, flow is determined by the higher pressure, right? The better that gradient, the faster the flow. And so we set that up for you. And if I talk to you about that and you've taken physics and you can't get it back to me, then I'm looking at you kind of crazy like you aren't a prepared student because yes, you shouldn't know about heart physiology, but you should know about basic physics. So I'm judging you based on that. When you get to the medical student level, now I'm judging you at that clinical level. So if I talk about a common disease like COPD or asthma, and as it relates to anesthesia, you should have an understanding of what COPD is, what asthma is, and how that fits in with our lung physiology and what I'm trying to do as an anesthesiologist. So you should understand how I do it as an anesthesiologist, but you should understand what those clinical conditions are, because that should be common knowledge, bread and butter for all medical students. Does everybody see? So whatever your level is, come prepared at that level. When you do show up, right, and you are prepared at your appropriate level, show up professional, y'all. Gosh, dang it. One of my favorite students is a medical student currently right now. And he just finished up his second year of medical school. He's taking step one right now. And he came to shadow me not too long ago. He came to hang out and talk about step one. And he shows up, and he's a medical student, and he shows up in what looked like sweatpants. They were scrubs, but they were big and baggy and kind of like a weird color. They looked like sweatpants. And then he had a sweatshirt on that said med student. And I get it. That's cool and everything. But it's a clinical environment you're coming into, and you're wearing a sweatshirt and what looks like sweatpants to my clinical environment. So immediately I'm like, come on, man, you're better than that. And I had to give him stern talking to about his wardrobe. But I can't tell you how many times I've had pre-meds show up to a clinical environment in sweats, in hoodies, open-toed shoes, things that are not appropriate for a clinical environment. I wear Crocs every day, but I wear my closed-toed Crocs. You can't be wearing your open-toed shoes. So for you guys, when you show up, yes, you want to be prepared. And then the second P, you want to be professional. Be professionally dressed. It sets the tone for the day. Overdressed. Don't wear a tux, but if you wear a suit, whatever. Be overdressed because it sets the tone. And they're like, hey, listen, at least he put on a clean shirt today, and he put on a collared shirt, and he's dressed professionally. I'll give you the benefit of the doubt on other things. It starts the day on a high tone. But if you show up and you're dressed poorly, I'm going to immediately start to judge you like, you don't take this seriously. You're showing up. Come on, in your pajamas? Come on. SpongeBob shoes on. Let's go. So we start there. So we show up prepared. We show up professionally. The other thing we show up, the third P, is we show up promptly. So 3 Ps. Prepared, professionally, and then promptly. If I tell you, hey, this is anesthesia, we start early. So the first patient will get here at 6 a.m. I get there at 5:30 to set up. What time should you show up as a pre-med or a medical student? If I say first patient shows up at 6, I show up at 5:30 to set up, what time should you show up? Definitely not later than 5:30 if you want me to take you seriously. If anything, you should shoot for 5:20, 5:25, so that way you say, hey, listen, I'm here. Let me know when you're here, Dr. Pinesett, and we can meet up. So that way I know my time is valuable and you're not trying to waste a second of it. If you stroll in at 6, because that's when the patient shows up, I'm already judging you. If you show up at 6:05 thinking, oh, well, the patient got here at 6, I can get here at 6:05, I'm judging you. Show up on time promptly. Again, it sets the tone for how serious you take it and how serious I should take you. Prepared, professional, and promptly. Then, once we're in the scenario, now we're in. Is everybody still with me? Like this video right now, let me know. It's Dr. Pinesett. We are live Mondays and Wednesdays at 4:30 Pacific time on this here YouTube channel. So if you are new to me, hello and welcome. Like this video, subscribe right now. We also have the podcast. If you're listening on the podcast, hello. Thank you for listening on the podcast. Take time, leave a nice review for the podcast so we can keep these going. These lives are going to meant to be more in depth, meant to be more about you guys. If you have questions, put the questions in the box, guys. I'm here for you guys. Even after this live goes up, right? It's already live. Oh, he's not on here. He's not live. It's already recorded. Take the time, leave a comment, ask a question. That's where I'm getting all these from, right? Like I had this medical student come and it becomes a video topic. So if you have a question, I'm here to serve you guys. I'm here to help you guys get there. I already made my medical dreams come true. I'm already a Stanford Med School graduate. I'm already the anesthesiologist. So I'm here to help you guys make that same transition and make your passions and your dream a reality. All right, so let me know. Be in touch with me. Make me feel like you're here with me. All right, so now we said we're going to show up. We're going to be prepared. We're going to be professional. We're going to be prompt. Now we move into the actual day. So now you're here. You've showed up. You're dressed sharp. You were on time. Great. Now that you're here, what I expect to see from future physicians, whether that's the pre-med or the medical student, is that you are proactive about your learning experience. Proactive, meaning you seek opportunities to learn. And one of the big mistakes, particularly medical students, pre-meds don't make this mistake as much, but medical students make this mistake is they think doing is learning. The only way to learn is to do something, they think. But what you should be doing is looking and listening, because that's how learning happens first. You may have heard the expression. I want you to write it down if you've not heard it. See one, do one, teach one. If you have not seen a procedure done, how can you expect to do one well, successfully? So as you want to learn from your clinical experiences, it's not just about doing. I want you to keep these 2 L's in mind. It's about looking and listening. So as I'm doing an IV, I'll talk you through it. Listen, I'm placing the hand this way. The needle comes in this way. You're going to see this catheter kind of release. I'm going to walk you through all the steps. So I'm going to be having you watch me. I'm going to have you listen to me. You can learn a lot that way, not just in terms of skills, because not all the clinical skills are going to be applicable to you guys. But what is important, and this is, again, where this look and listen comes into play, because a lot of people will sit back, be like, oh, okay, whatever's happening, I'm not doing anything. One of the most important things about clinical experience, and this is why medical schools put such a high value on clinical experience for pre-meds, is that a big part of being in the clinical environment is not just learning procedures or learning the actual how to do the history and physical and all those kind of things. It's about learning what it is to embody a physician, to hold the characteristics of a physician. And if you watch closely what the physicians are doing, if you listen to what they say and how they say it and how they go about things, you can learn a lot about what it means to carry yourself like a physician. That's what the opportunity is. We have to look and we have to listen so we can embody what it is to be a physician. It's so important, guys. It's not about, oh, we did this. No, what is that physician doing? Look at how they interact with the patients. Look at how they interact with the rest of the healthcare team. Look how they interact with their colleagues. Look at how the medical environment works. That way you can seamlessly integrate yourself into that environment throughout your career. As you progress, you understand the dynamics of it. So it isn't awkward, it isn't unknown, it isn't all those things. Even so much as when you're a pre-med student, watch what the medical students are doing. When you're a young medical student, watch what the senior medical students are doing. One of the big mistakes a student actually recently made, and I was like, no, don't do that, is they introduce themselves as future Dr. Joe, insert their name. And I was like, do not do that. And they're like, why? They're like, yeah, I got some feedback on that, but I thought they were just being mean to me. I'm like, no. You don't introduce yourself as a future doctor, whether you're a pre-med or a medical student, because you're talking to someone in a moment of duress. No one goes to the doctor unless it's a well check because they feel good. They're going there because they have some complaint. There's some distress they're under. And so in stressful times, when you're concerned about your health, It's easy to lose words in what's being said. So when someone says, I'm future Dr. So and so, they zone in on doctor part. And so they can mistakenly think that you are the doctor. And it creates confusion amongst the team what your role is for the patient. Instead, introduce yourself as, hi, my name is Joe. I am a pre-medical student who is here to shadow. So you're very clear about your role. Hi, my name is Joe so-and-so. I am the medical student on the team. I am here for anything you may need, and I will relay it on to your primary doctors. That's clarifying and communicating your role with the patient. And so if you have watched this, if you have seen how people introduce themselves, you'll know how to appropriately introduce yourself to a patient, let them know what your role is so they can know what to expect from you. And that's, again, that looking and that listening, embodying the physician. Beyond the, like I said, the doctoring skills, look at the characteristics that go into being a doctor. Things such as, we talked about, communication. Additionally, empathy. And this is a big one for people. I can't tell you how many times a student has been on rotation with me and they think expressing empathy involves crying, involves, oh no, sighs, and that's not empathy, guys. Empathy is being a pillar for the patient. They're going through something difficult. Their family's going through something difficult. It's not for you to share their same emotion. If they cry, it doesn't mean you should cry. You should be the pillar supporting them, telling them, hey, it's okay to cry. I understand, but I'm here for you. You're going to be their rock, their pillar that's lifting them up. They don't want you to be crying too. So that empathy that you express, you literally express through words. Man, I can't imagine what you're going through, but I sympathize with you. I understand it's a difficult time for you. Please let me know if there's anything I can do to be supportive for you. I can tell you from my side as a medical student, as a clinician, that this team did everything they could do to support your family member. So rest assured that everything was done to save their lives, and know that people here cared about your family member. Things like that. Express empathy. Look at how people and listen to how they express empathy in effective ways beyond like, oh my God, it's emotional. Forget that. Express it in a professional, supportive, pillarly way. Look at teamwork and dynamics. I literally, I'll kick a med student out. I'll kick a pre-med out in a heartbeat. You are there to learn. Part of that is the teamwork dynamic. You should never call someone by their role. You should always learn people's names and call them by their name. I can't tell you when I med student, hey nurse. What's the nurse's name? How about, excuse me, nurse? I'm sorry, I don't know your name. Could you please tell me your name? Oh, thank you so much, Joe. Joe, I'm looking to help my anesthesiologist do whatever. Learn the people's names and show them that respect, guys. That's part of the team dynamic. When you show up, if you enter a space and you're a pre-med or you're a medical student, everybody in that gosh darn room better know who you are. If you walk into a space, hey guys, I don't want to interrupt, but I'm Joe. I'm a pre-med student. I'm here shadowing with Dr. Pinesett. I'm not doing anything today, but I just want to let you know that I'm here so you don't think there's some weird guy standing in the operating room. Hey, my name is Joe. I'm the medical student today on your guys' team. I don't want to get in your way in your flow, but I just want to let you know I'm here, and I'm here if you need anything. And then every time someone speaks, oh, thank you for speaking to me. What is your name? Okay, oh, great. Okay, also. That creates that rapport, that creates that connection, and we're watching that as attendings. As attendings, we're looking at you and we're like, hey, how does this person do when they think I'm not looking? How does this person do with the janitorial staff, with the scrub tech, with whoever who might be quote unquote people can look down on? No, they're all valued members of the team. How do you treat them? Do you use their name? Do you help them? Do you step up? Do you do all these things? That makes the difference. We're watching you be a team player, even as a pre-medical student, even as a medical student. That goes into your evaluations. Treat people with respect. Okay? Additionally, look at how clinicians approach problems. And it goes back to what we were talking about earlier with this not being a know-it-all, but being a learn-it-all. Look at how physicians are not scared to ask their colleague for clarification. How they're not scared to ask for additional information from a family member. How they're not scared to talk with a nurse about what might be going on. Look at how they talk to a pharmacist about contraindications and drugs. Look at how that physician goes about solving problems, getting information. And there was a quote, and I won't butcher the quote, but there was a quote, I want to say it was either Rockefeller or something like that. And it was a great quote because it was talking about how someone was trying to put them on like a game show or something where they're trying to test their, how smart they were for things. And like every single question that they got asked, they didn't know the answer to. And the guy's like, man, how do you not know any stuff? You're supposed to be so super smart and all this stuff. And the guy's like, listen, I don't have all the information. But what makes me successful is that I know what I know, and what I don't know, I know how to get the information. And that's what being a clinician is. You may not know everything. Someone may come with some crazy disease you've never seen before, or something you've never seen for a long time. It's not about necessarily knowing it right off the bat, but it's about saying, okay, wait, I don't know that, but I know this. So let me go ahead and fill in the gaps and get this information either from my colleague or from this or from this. It's about being able to access the information you need and being an information seeker and a learn-it-all, not the know-it-all, so you can get there for your patient. Yes, yes? So, problem solving, get those skills. Understand how all these things come together. Now, you've showed up. You're the 3 Ps. You're professional, you're prepared, you're prompt. You then follow that up, right? And you are being a listening, looking learner that then puts you in a position to do and make a difference. What is the last component that I want to stress with you guys today to make the most of your clinical experiences and your clinical opportunities? Let's talk about it, right? First, like this video, y'all. Let me know you guys are here. I appreciate it. Jay, what up? Everything's good. That's what's good. Everything's good. Harvey, you are very welcome. I will keep these videos coming. I'm glad they're motivating you. You're educating you. That's what we're here for. Positivity, productivity, empowerment, helping you guys reach your goals. Your success is what I'm interested in. So let's succeed together, right? Let's get it done. The last thing I want you guys to do, you go to your clinical experiences. We've done all the right things. Let's remember what the purpose of clinical experience is. First and foremost, it's a learning opportunity. It's a growth opportunity. It's an opportunity to see if being a doctor really is what you want to be. And what type of doctor, if you're a medical student, what type of doctor you want to be. So at the end of all these experiences, I want you to make sure you take the time and you reflect. Not at the end of a rotation, not at constantly. If you guys ever come find me, if you guys see me out clinically, I want you to run up to me and say, Dr. Pinesett, show me your notebook. And I'm like, got you. And I'll pull out my tiny notebook. It fits in this top pocket. I buy them, the Moleskines, little 3x5s. They fit right in this top pocket. I'll always have a Moleskine on me. If not, you'll see, I'll pull out my phone. I'll have a ton of notes in my phone in my note app. Either way, I'm constantly, throughout the day, little things happen. Oh, I had this patient encounter. Okay, let me write this down. Wow. Because those little moments happen and you say, oh, I'll remember this. You're not going to remember it later. Take the time, take a second and write it down. And I mentioned the notepad because for a lot of you guys in clinical environments, one of the mistakes students make is they're too technology driven. They want to pull their phone out to do stuff. The problem is if you have your phone out, I don't know if you're texting. I don't know if you're writing something nice down. And so what am I going to assume? Probably you're texting. So if you can have a notebook that's separate from your phone, it really plays very, very well. So get a little notebook, and then as things happen, write them down. Let them see you. Oh, they're writing stuff down? That's amazing. But then more importantly, it's a reference for you. So at the end of the day, you're like, oh yeah, I did write that down. And then you can expand on it. You can elaborate on it. You can really reflect on your experiences. And this helps tremendously give you the talking points you need for your application and for your interview, whether it's for medical school or residency. So take that time, reflect, not only on what's actually happening clinically, but reflect on the lessons from it and how you're going to implement it, not just that day, but going forward in your life. And one of the things I like to do as an exercise for me is I ask myself, even before I get on here live, I'm always asking myself, how do I want to show up such that others see me? So how do I want others to see me? And then based on how I want others to see me, I say, well, how do I have to show up? So when I start these YouTube live streams, I'm always like, hey, this is a YouTube live stream. These people have millions of people that can be listened to on the internet. It's important that I bring them highly actionable information. So I want to show up and I want to give you good stuff that you can take away after this video and make a difference. I want to make sure that I'm sending out positive vibes. So I want you guys to feel my energy. You guys feel my energy? I want you guys to feel that energy because I want you to leave, even if you don't like the information. I want you to leave saying, hey, listen, that guy was energized. I should be energized like that. I want to bring you guys that energy. So every experience I enter, I'm always thinking about how do I want to be perceived? And then based on that, what do I need to bring to that experience? And that's where the reflection can get you. So if you're reflecting like, listen, how was I today? How did I do in these interactions? Oh, there was this learning opportunity where it didn't go as well as I wanted to. Okay, what will I do differently next time? And we can improve and we can shape so that our next experience is also great. The other last component I'll say about that reflection is that you guys want to be looking at as you go through clinical experiences of, hey, how am I in terms of concretizing this experience? This is something I use with my pre-med students. I talk about how for our extracurriculars, we must concretize the experience. You can do this in quite a few ways. With clinical experience, one of the best ways and the most essential way to concretize the validity of that clinical experience is to get an outstanding letter of recommendation. One that speaks of how you embody all the characteristics that make up a great physician, and how this person who is currently a clinician, like an anesthesiologist, believes that you will be an amazing anesthesiologist, you will be an amazing doctor, and they have no doubts, no equivocations about your capability and your competence to be incredible. So make sure that you are putting yourself on track. Say, hey, who's going to be my letter of recommendation writer? Am I making the right impression? Am I establishing the rapport? Am I showing them that I'm here to learn, that I'm growing, that I'm taking what they give me and I'm able to apply it effectively? Where's my letter of recommendation coming from? And if you focus on that, again, not only will you have a great experience, but also it'll be very fruitful for you in moving to the next step in your future doctor life. All right, guys? Can we end there? We're at 31 minutes. I appreciate you all. I hope this was hugely informational for you guys. We'll continue to talk about pre-med extracurriculars. We'll talk about shadowing. We'll talk about clinical experience, more things to talk about. But I wanted to make sure we got this down today, fresh off this medical student who was terrible clinically with me. But I gave them this feedback not on day 10. I gave them, as soon as I notice these things, I'm giving immediate feedback. Hey, this is not working. This is not working. That way they can make a change, make a difference, and sway me by the end of their rotation by responding. And thankfully they did respond, they did improve, and so I'm going to give them a really nice evaluation for the rotation. But that's what it's about, guys, is taking this feedback. So that way you don't even have to start the rotation bad. You guys can go into your shadowing, go into your clinical rotations, clear about what you're trying to do, and you can be competent about it, and you can execute it, and then you can have a great outcome and get to your next level. And that's what we're here for, guys. So if you enjoyed this, please take a second, like the video, comments. Hey, Dr. Pinesett, thank you so much for being here today. Thank you for taking time out. I'm missing the start now. I'm running late now. The start of my son's basketball practice. So say thank you, Dr. Pinesett, for being here with me, sharing this information for me. We are live action every Monday, every Wednesday, 4:30 p.m. Pacific Standard Time. We've got the podcast, guys. It's Premed Productivity Podcast. So make sure you guys are getting to the podcast. If you love my channel, I can't tell you enough how my channel is nothing compared to my coaching programs. If you think we're real and raw and amazing on here, I'm here to transform you. I want to get specifically into what ails you. I want to get specifically into your goals, and that's what we do in my programs. I work with the individual student to help you become amazing, to help you become the great student, to help you become the great pre-med, help you become the great doctor. That's what I do. So get to my website, premedproductivity.com, and get with me. Yes? Student Dr. Antonio Patterson, one of my OG students, who's now, right, living the life. He's now an older, and I keep saying, Antonio, please send me an email, please, Andre at premedproductivity.com. You know the email address. Send me an email so we can have you on here. I want to interview you, and we keep saying this, but let's actually make it happen so we can get you on here, sharing your story, sharing your experiences. He's very insightful. Make sure you guys follow his YouTube channel as well. Put your link in the box right here, Antonio, so they can get that. But I love my students. Antonio goes way back with me. He's an older medical student, and he made his career change. He made his thing, and he made his dreams a reality by getting with me. But then most importantly, he was listening. He was looking as I was speaking, and then he was implementing. He was doing, taking that, actioning that, and creating his career. And so I'm proud of him, and I hope to be proud of you guys. So have a wonderful day. I'll see you guys. This is Monday, so I'll see you guys Wednesday at 4:30 p.m. I'm not sure what the topic is yet, so if you put a comment in the box and let me know what you guys want to talk about Wednesday, maybe we'll talk about that on Wednesday because I'm here for you guys. Thank you so much. See you next time, guys.